This talk is going to be about obtaining competent occupational hygiene services. My name is Dave Rogers, and this is designed for people who are looking for purchasing occupational hygiene services either as a buyer, a client, or a customer. If you're a buyer of occupational hygiene services, you need to have assurance that you will receive competent support. In this presentation, we'll discuss some of the BOHS resources that are available to buyers, namely the Buyer's Guide for Obtaining Occupational Hygiene Services, the Faculty of Occupational Hygiene's Good Practice Guide for Consultants, and the BOHS Directory of Occupational Hygiene Services. These resources can be used so that we ultimately seek a win-win situation, which hopefully will lead to ongoing relationships where the consultant can be trusted as an advisor to the client. The first thing we'll talk about is the BOHS Buyer's Guide for Occupational Hygiene Services. You can follow this web link to get the latest version of the Buyer's Guide, and it looks like on the screen here. This was last published in September 2019. And the next few slides will go through just what's in the Buyer's Guide and lead you through that. But first, like all professions, just the use of the term occupational hygienist is not necessarily a protected job title. Similarly, anybody could call themselves an engineer, for example, or a scientist, without actually being a fully competent or professional provider of those services. However, if you see somebody who's got a chartered occupational hygienist title, you will then know that they have a protected job title, because BOHS has the Royal Charter from the Privy Council, which allows them to qualify their members who are professionally qualified as being chartered, just like in other professional organisations. And so only chartered members or fellows of the Faculty of Occupational Hygiene of the BOHS can actually legally use the Chartered Occupational Hygienist title. The aim of this guide is to assist businesses wishing to engage the services of occupational hygiene consultants to obtain the appropriate, competent advice for their particular needs. So let's think a little bit about why, as an employer, as a buyer, as a client, or a customer, you need to think about your responsibilities from a legal perspective. Regulation 7 of the Management of Health and Safety at Work regulations requires all employees to appoint one or more competent persons to assist with their health and safety arrangements. For complex exposure scenarios and or perhaps high hazard workplace agents, where those employers may not actually have the relevant in-house expertise, and they may actually need to take external advice from a specialist such as an occupational hygienist. Similarly, in the COSH regulations and the associated approved code of practice, these highlight the need for employers to be able to assess the competence of their advisors. An employer needs to take all reasonable steps to ensure that their consultants are competent. And it's not only must the people who advise on assessments and control measures be competent, but also those who do the checks and tests of those control measures. So you have legal responsibilities to obtain competent specialist health and safety advice. So how do you go about getting an occupational hygiene specialist? First of all, you need to ask yourself some questions. First of all, if I'm a buyer, if I'm a client, if I'm a potential customer, what is the challenge that I'm seeking to address? If I was to engage a specialist to help me, what would I need to do? What would I need that specialist to actually do for me? And will the specialist be good enough to be able to solve the problem that I've actually got? Any competent consultant should know what competence and their competence looks like, and they should be able to demonstrate it to you. If you are in any doubt, you can check with the relevant professional body for guidance on their relevant training, their knowledge, their qualifications, and their membership grade and status. From the perspective on occupational hygiene support, it's a good indication of competence if the company is included in the BOHS's Directory of Occupational Hygiene Consultants, which we'll discuss a little later on. So I'll just take you now through the classes or categories of occupational hygiene specialists and their competency. And the first category that we have is category 1, and this is the chartered fellow or chartered member of the Faculty of Occupational Hygiene, or a specialist member of the faculty. The chartered fellows and members are holders of the Diploma of Professional Competence, and these people are the ones that are the most broadest and deepest experience. They work to the highest professional standards, and the sorts of work they can do is they can assess risks, they can devise sampling strategies, and recommend fit-for-purpose control measures to reduce worker health exposure. These people are likely to be the technical leads within the organisation. They're likely to be capable of operating at a senior managerial level, and they would set the professional standards accordingly in their own organisations, and also mentor others in their organisations. So category 1, chartered members and fellows, they are at the top of the tree. The next level is category 2. And in this category, we have licentiates of the Faculty of Occupational Hygiene who hold a certificate of operational competence, or they may be specialist licentiates who work within their particular scope of specialism. For example, they may be specialists in asbestos or noise or ventilation. They are able to assess risks, devise sampling strategies, and they recommend fit-for-purpose control measures to reduce worker health exposures. People in this category normally only require the occasional supervision or technical support, which would be provided by category 1 chartered fellows and members. Category 3 are what are called associates. And they can be thought of as occupational hygienists in training, if you like. They will have passed an appropriate occupational hygiene module or modules. They're called the W modules, which a total of 6 make the full set of the knowledge base to which an associate needs then to progress towards the certificate of operational competence. They may also have an approved occupational hygiene degree from an approved university. They're technically competent to undertake surveys, inspection and testing in accordance with their own knowledge, experience and training. They should be under the supervision of a competent person who reviews and signs off their reports. The level of supervision for this category is more than category 2. It could be infrequent for less complex work, like at least quarterly, and less complex work in this scenario means routine testing or simple monitoring. Or it may be more frequent, for example, weekly supervision for the more complex work where, for example, you may be determining compliance with a particular set of workplace exposure limits. And they only work within their knowledge and experience competencies. So they're in training, but they are in the process of becoming more qualified. The final category is category 4. These are technicians who have, they may be called technicians, and these people have no formal occupational hygiene qualifications. So they're right at the start, or maybe they are in another field and they are looking to do occupational hygiene work. They may do less complex work, but they do need to operate with a high degree of supervision. Generally from at least a category 3 person, and more desirably a category 1 or 2 person, with frequent, at least weekly or even daily supervision. People who operate in category 4, who are not under the supervision of an occupational hygienist from categories 1 or 3 above, are not deemed by BOHS to be competent to undertake occupational hygiene consultancy work. So we've talked about the legal aspects and the personnel aspects. Now, so you get to the point where, well, I need to get a quotation. Some of the things you need to have before that are as follows. For example, you need to be able to describe the actual process that you're interested in, the various hazardous substances and perhaps other physical agents like noise and vibration or heat perhaps that are actually in use in the process, and also the sources of those workplace exposures. Safety data sheets for hazardous substances are also useful. As you write a work scope to engage the services for an occupational hygiene consultant, you need to think about the reasons for the work scope. Is it going to be to estimate or quantify exposure as part of a risk assessment process, perhaps for a new product or process? Is it to check on the effectiveness of the existing controls within that workplace? Is it for the routine regulatory requirements, such as the thorough examination and testing of local exhaust ventilation systems? Or perhaps is it for another purpose? You need to decide which of these, what the actual purposes are of the services that you are requiring. For unusual or new risks or processes, or for multiple sources of exposure or multiple hazards for which more complex controls may be needed, you probably want to be looking at a consultant who has a broader or deeper experience, such as a chartered member or fellow. As you're obtaining a quotation, find out about the consultant's insurance levels, for example, their levels for professional indemnity and public liability. Who's actually going to be preparing the quotation for you? Is it going to be a competent occupational hygienist? If it isn't, any quotation needs to be checked by a competent occupational hygienist to ensure that it actually meets your needs and also meets the scope of work and the outcomes that you're looking for. When you receive the quotation, you should check that it includes everything that you've asked for, it meets your needs, and that the lead time and completion timescales are satisfactory. In the case of work which includes measurement, check that the work scope includes enough sample numbers to allow statistically significant data to be gathered. Are there any caveats within the quotation? Are there any conditions to which the quotation is written? For example, it may assume that the processes in question are actually working full-time for 6 to 8 hours, for example. It may require certain individual workplace personnel to be in place. It may be that for some reason other other individuals need to be watching the monitoring or to watching the process. So are there any caveats in there? What category of occupational hygiene staff will actually do the work? Will it be a chartered member? Will it be a licentiate? Will it be an associate? Will it be a technician? And then when the report is actually produced, is it going to follow the principles which have been given in the BOHS's resource clear and concise report writing guidance, so that you can be fully assured that the actual product is appropriate and consistent with the report writing guidance in the profession. Cooperation and coordination. As a buyer, you'll need to make sure, as a client, as a customer, when the consultant turns up, they need to have all the relevant information in front of them so that they are able to recognize, evaluate, and control the risk to health in your workplace. This means that you have to ensure that the specific processes are running, the ones that we're looking at specifically, and that the relevant operators and/or maintenance or engineering staff are actually available. If the consultant is going to have to undertake work at height or access and inspect particular equipment, there is obviously suitable coordination has to be put in place to ensure that this work can be undertaken safely. And once the work is actually started, you should make sure that you keep a check on just how the work is going and is actually going against what you have agreed for the scope of work. How do you make sure that you've received the needed help? Well, if you've had a consultant in, how do you know you've actually received what you'd asked for in terms of that? Well, each report should answer the question of what the aims and objectives were for the particular scope work that you had. And so does the report provide you with practical, sensible solutions to your problem? That is, it provides solutions, and it doesn't just highlight problems and points out legal non-compliance aspects. Or do you think that you've actually ended up with something that's completely over the top, or is just simply a mountain of generic paperwork which hasn't been tailored to your particular workplace and aims and objectives? If necessary, ask the consultant to explain and to consider whether there may be a simpler alternative to what they're suggesting. Read the report when you receive it, and if there's something that is incorrect or you do not understand or agree with, then take it up with the consultant accordingly so that you get good clarification and positive understanding on both sides. Have you received good follow-up support following the report? In the Code of Practice of the BOHS, it states that faculty members shall practice their profession with integrity, providing sensible and proportionate advice by making clear what health and safety laws are required to be complied with. They exercise professional judgment to decide what action must be taken in a particular situation, and they distinguish clearly between the legal requirements and best practices. For example, they make it clear by using the words must do for the legal requirements and could do for best practices. And make sure you understand their recommendations and the difference between the ones where you have to do something, you must do something, and what you could do. And ensure that you've dealt with any questions you had about implementing the various recommendations before carrying out the implementation. If things don't go well, you may wish to follow the complaints procedure which the Faculty of Occupational Hygiene Committee is responsible for. The committee is responsible for the maintenance and improvement of occupational hygiene professional standards, and they can take sanctions against faculty members if they breach the Code of Ethics. There's an established complaints procedure, which has the objective to handle complaints in disciplinary manners in a fair and reasonable manner. It lays out the actions that will be implemented by the BHS if there are allegations against an individual member of the faculty in relation to the compliance with the Code of Ethics. We should point out here that the BOHS acknowledges that compliance with the BOHS Code of Ethics is mandatory for all non-retired members of the faculty, and compliance with the Consultant's Good Practice Guide, which we're about to talk about, is currently a voluntary commitment for those organisations in the directory of occupational hygiene consultants, which we'll also talk about soon. So that's the buyer's guide. The next thing I'd like to talk about is the Good Practice Guide for Consultants. This was issued in March 2019, and the web link is there for you to download from the BOHS website. The aim of the Good Practice Guide for Consultants is that it aims to assist consultants by providing interpretation of the Code of Ethics, outlines their legal duties, and translates individual competency into a high-quality service provision. So it aims to raise the standards of worker health protection in the process. So by upgrading the quality through continuous improvement for occupational hygiene consultants, we are also raising the standards for worker health protection at the same time. The following slides look at some of the key sections of this guide. The BHS Code of Ethics states very clearly that what an occupational hygienist is all about is worker health protection. This is the highest thing in our view when we go into a workplace. Are we providing, or is worker health protection being provided for? Consultants must be able to demonstrate their competency, and they must not misrepresent qualifications or membership status. So some very simple ethical aspects there for our occupational hygienists to maintain. When we talk about competency and supervision, first of all, a competent occupational hygienist is defined as a Category 1 or Category 2. That is a licentiate or a chartered member or fellow. That is a competent occupational hygienist. An associate or a technician or other person is not able to undertake more complex work and has to have a degree of supervision by a competent occupational hygienist. And the level of supervision varies depending on a number of factors which are further explained in this Good Practice Guide. When a consultant quotes and designs a survey, there's some things that are included in the guide. First of all, a preliminary site visit is recommended, particularly to understand the problem and also to meet the client and to fully understand the client needs, and also to understand the workplace as well. Estimators and sales representatives may go to carry out a site visit or prepare a quote, and they should be qualified and have an understanding of the basic principles of occupational hygiene. If quotes and survey proposals are not prepared by a competent hygienist, then any quotes and survey proposals need to be checked by a competent occupational hygienist. As with the buyer's guide, we mentioned the report writing, and it should follow the guidance of the clear and concise report writing guidance. It's a code of ethics requirement for recommendations to be clearly prioritized or given significance. And the report author's assurance of competency should be within the report. So the author has to put their name in and state what their competency level is, whether they're a chartered member, a chartered fellow, a licentiate. Quality assurance and quality control aspects. Whilst it's not necessary to have a full-on quality management system, the company should have suitable arrangements to assure the quality of the site work, the control of the quality of the report outputs, and the audit of the completed work. As far as implementing this good practice, all consultants are required to assess themselves against this guide. And as mentioned before, to get into the directory of occupational hygiene consultants, which is in the next slides, there's a voluntary requirement to commit to following the guide as part of the being a member entrant of the directory of occupational hygiene consultants. So finally, a couple of slides about the directory of occupational hygiene services. The directory of occupational hygiene services can be obtained from this website, and I will just bring over another picture of that, of what that actually looks like in practice. As you can see, as you go down it, you will see there's a list of different companies with different names. You click on various links, there's email addresses and so on. So if we pick on any of these, you'd click on one of those links, you would come to a full-on picture of, here's an example here of a web entry. Where's it gone? So we've got something about their company services, their company website, their address, an email address, some details about the company and how many chartered people are in place, and the regions where they work and the services that they provide. The Directory of Occupational Hygienist Services is the definitive list of organisations that are able to provide qualified and experienced occupational hygienists and specialist occupational hygiene support services. To get onto the directory, it depends on the company being able to provide the following three things. The company must be employing at least one licentiate, chartered member or chartered fellow of the Faculty of Occupational Hygiene. Those faculty members have to be up to date in their BOHS membership subscription, and the faculty members need to be participating in the BOHS's continuing professional development scheme. As you can see, whilst appropriate professional qualifications may not alone guarantee a good consultancy service, they certainly make it a lot more likely. And the BOHS has published this good practice guide for consultants, and those following this guide are likely to have an appropriate management system in place to ensure that they facilitate a better quality of a competent professional occupational hygiene service. The directory itself has entries listed both alphabetically and regionally. The main address is the main office of the company, and if there's other company offices, these are also listed within the entry itself. The contract listed is a member of the Faculty of Occupational Hygiene, and though there is a regional segmentation for the companies for the purposes of this publication, you can search also by companies who do offer a nationwide coverage, and indeed who provide coverage overseas. The main part of the entry is a summary of the company's areas of expertise in occupational hygiene and related topics. Bear in mind that this information has been provided by the company and that BOHS cannot accept any responsibility for any inaccuracies relating to this specific information. The company's entry may also include other services which will be peripheral to those offered for occupational hygiene services. So it could be environmental or safety services, for example. When a company lists accreditations for these other peripheral services, users of the directory may wish to also verify these via the relevant accreditation body for these services. To find out more about a company, you can also click the link on the company name or visit the website to find out a lot more information, and of course, contact the company directly. So, in summary, I hope you'll see that the buyers of occupational hygiene services do need to be able to find ways of providing assurance that they will receive competent and professional occupational hygiene services. And they can use the BOHS resources, which are available online to buyers, clients, and customers to assure themselves of the competency of the professional occupational hygiene services that they're looking at. You can go to the Buyer's Guide for obtaining occupational hygiene services, the Faculty of Occupational Hygiene, the Good Practice Guide for Consultants, and the BOHS's Directory of Occupational Hygiene Services, all of which are available online. Thank you.